Considering a hysterectomy, everything you were afraid to ask. While October is Breast Cancer Awareness Month, we wanted to discuss a sensitive topic that is unique to women's health and that is surrounded by many questions, including its relationship to breast and other cancers. Welcome to Health Talks. I'm your host, Laura Termini, founder of chickenol.com. And today my guest is Dr. Jose A. Carullo, an obstetrician gynecologist at the University of Miami Health System. Welcome, doctor. Thank you so much for taking the time to be here with me and answering this question. So this is a topic that I was very nervous to talk about.
Thank you for having me. It's a pleasure for me to be here. I'm ready to answer any questions you might have.
Okay, I'm gonna just shoot the questions that I was looking at on Google. These are the most, questions, including some of these are frequently Googled. What is a hysterectomy? That's the first question.
Okay, that's a very interesting question and a very important question for people to understand. Hysterectomy, the term itself means removing the uterus, so the womb. A very common misunderstanding is what is a total versus a partial hysterectomy. Many people ask, I don't want a total hysterectomy, I want a partial hysterectomy. Well, what defines total versus partial? Well, first of all, partial hysterectomy, it's a lay term, it's not a medical term. We say either total hysterectomy or supracervical hysterectomy. The distinction is important to understand. The hysterectomy could be partial or total with or without removing the ovaries. So people think that if you do a hysterectomy removing the uterus but leaving the ovary, it's a partial hysterectomy, and that is not correct. What it's a partial hysterectomy is when you remove a part of the uterus but you leave the cervix inside. So there is the body of the uterus itself and there is the cervix. Those two structures, when you remove both, that's considered a total hysterectomy. When you remove only the top, leaving the cervix, that's a partial hysterectomy. And you can have both types with or without removing the ovaries.
How do you know if you're going to do a hysterectomy in a patient? What are the things that happen in a woman's body so you can, decide to do this and go for it?
Well, there are many reasons for hysterectomies, right? And to better answer this question, this is a very dynamic thing because has evolved over time. So the medicine, the gynecology that we're practicing today in 2021 is different than the gynecologies that we were practicing 10 or 20 years ago, which is really important because many patients, their mothers and their grandmother had hysterectomies at age, let's say 40, 50, and now they're reaching that age and they think, well, it's my time to get a hysterectomy because my grandma get it and my mother get it. Now I'm at that age, it's my time to get a hysterectomy. That's no longer the case because gynecology has evolved and technology has evolved so much that the indications for hysterectomy are less and less. So today we have many other options that will treat the condition, preserving the uterus, not needing to remove the uterus. So you get treated, you get your problem solved without the need to perform a hysterectomy, which wasn't the case 20, 30 years ago.
Is it always related to cancer cells in the uterus?
Absolutely not. There are reasons for hysterectomy. There are benign conditions and there are malignant or pre-malignant conditions. Two different things. So let's talk about the benign conditions first. The most common causes for hysterectomy, pelvic pain and abnormal uterine bleeding. Those are the two most common causes. And the reasons for the pain and the bleeding, the most common cause is fibroids. Oh. Yes, so that's on the benign side. Then the malignant side, that's a totally different discussion, and that's also a different type of hysterectomy because we also have different type of total or complete hysterectomy. So when you get the hysterectomy for benign conditions, it's a hysterectomy that we remove only the uterus when the hysterectomy is performed for cancer conditions, sometimes the margins of the area that we remove is a little bit larger because we want to make sure that we remove all the malignant cells that are in the uterus or probably around it. So it's important to understand that reasons for hysterectomy for benign conditions are many, but there are also many options to treat the conditions without needing to perform a hysterectomy. When we talk about cancer, that most of the time, yes, the hysterectomy is the indication, and there is no, it's not an option to treat cancerous condition, usually saving the uterus.
And talking about that, there's a lot of questions about if the hysterectomy increase the risk of cancers, of even getting breast cancer after it.
No, absolutely not. The hysterectomy will, if anything, decrease the risk of cancer on the uterus. But remember that what is correlated is most breast cancer is correlated with ovarian cancer, not necessarily with uterine cancer.
Okay.
But patients who have history of breast cancer sometimes are receiving drugs, which tamoxifen is a very common one, that will increase the risk of getting uterine cancer now. Oh. So there is something that's called risk reducing hysterectomy with bilateral saprophorectomy, which is removing the uterus and the ovaries in patients who have had breast cancer. So we remove those organs in prevention before they develop breast cancer. So that's why we call it a risk reducing, meaning you don't have the condition, but you have the risk, and we want to reduce that risk to minimum. So we remove those organs that you don't need, to survive. There's no organs that you need. So we remove them in order to decrease the chances of, God forbid, a patient who already had breast cancer also develop ovarian or uterine cancer.
So a patient who was okay, not feeling anything, but all of a sudden starts having pain and painful experience every month, and then goes to you, and then it makes an appointment and you see something there. So I think it's a procedure, right? That you have to follow step 1, step 2. It's not like, oh, I want to have it because somebody told me. You need the doctor to tell you and to guide you through it.
Absolutely. So my first recommendation is, first of all, every woman should get her annual exam, right?
Of course.
So let's start from there. So every woman should go to the gynecologist or their primary care physician if they're going to a family physician or somebody who's doing their primary care every year. And although we're no longer performing pap smears every year anymore, we're spacing them out a little bit more if the patient have never had a normal pap smear, but that's a different discussion. Even if you not need your annual pap smear, you still need the yearly checkup. Besides that, because at that yearly checkup, the doctor will perform a pelvic examination and might detect abnormal conditions even before they start giving symptoms, and which is really great because you treat the condition in the very early stages, which is much better. The other thing is, besides getting your annual exam, if you you notice that something changed. So usually the menstrual pattern are the same. If a patient bleeds regular every 28 days, then they bleed every 28 days. If they have cycles that are lasting longer, they're always the same. If a woman notice a change on her pattern, which is not the usual, then my recommendation is to reach out to a doctor, because that change in the normal pattern could be the first clinical sign or something abnormal that needs to be,
And what happened, doctor, after the surgery? Because I've asked, and I have somebody who's very close to me, she said to me that she had the hysterectomy, and then she started having kind of like a menopause. It was like a menopause right away, and she was young. She was 45.
Okay, because that's another concept that's really important to clarify. What dictates menopause are the ovaries. It's not the uterus.
Okay.
The uterus The only function of the uterus is reproduction, and then it menstruate during cycles. So if the hysterectomy, again, is total or partial, but without removing the ovaries, then you're not gonna get menopause. You're not gonna bleed anymore, but you're not gonna get menopause because the menopause gets dictated by the ovaries. Your ovaries gonna continue to produce hormones. You will continue to have a cycle, a hormonal cycle. However, you're not gonna bleed at the end of the cycle. So your hormones will be the same. Your body will still continue thinking that you have to do your menstrual cycle, but you're not gonna bleed every month. And your menopause or your symptoms of menopause will come at the age of whenever, like I tell my patients, whenever God sends you menopause, you're gonna get menopause. It's age 50, 51. By the way, the average age of menopause in the United States is age 51. So if we don't remove the ovaries, we remove only the uterus at age 45, like your friend had, if probably what happened with her is that they removed the ovaries. And that's why if you remove both ovaries from a patient, she will go into menopause immediately. And that's what we call a surgical menopause, which is a menopause that gets very abrupt because it's surgically induced. You're removing the ovary, and the body is used to have normal level of hormones, and all of a sudden has zero because you remove the ovaries, which is different at the menopause, that natural menopause, that the ovaries start functioning, little by little, and the body gets more time to readjust at this lower level of hormones. So it's important to understand
after the surgery, like your body gets used to not having the uterus, and you can just go on in life like
normal life. Absolutely, totally normal life. And currently we have technology. We have the robotic technology, the laparoscopic technology, that are minimally invasive access or vaginal hysterectomy. That the recovery, it's really quick. It's 1 week, 2 weeks at the most. You're back to work. The hysterectomy is an ambulatory procedure nowadays. So the patients, over the last 2-3 years, I've sent all my patients with performed hysterectomies home the same day. They don't need to stay overnight at the hospital, and the recovery is in a couple of weeks, because I specifically perform robotic surgery, and with the robotic technology, the pain is so little and the recovery is so fast that allows me to send the patient home the next day, the same day of the procedure.
And my guest today is Dr. Jose Carullo, an obstetrician gynecologist at the University of Miami Health System. And doctor, we're talking about hysterectomy, and I was just Googling questions and, reading forums and asking my followers, my friends, and there's a question that was it popped up. Can you still have an orgasm after a hysterectomy?
That's a very, very important question, and the answer is yes. You'll have exactly the same as you before your hysterectomy. The uterus has nothing to do with sexual pressure. Sexual pressure is on the outside, and the clitoris is on the external genitalia. Mm-hmm. It's on the external genitalia. It's nothing to do with the uterus. So yes, your sexual life is exactly the same. Actually, some patients tell me that the sexual life becomes better because now they're not bleeding anymore. They're not concerned that they might get pregnant, and the sexual life actually improves after the hysterectomy.
Wow, doctor, thank you so much. That was very informative, and I always say to my chicanos that you have to go to the doctor. You have to make an appointment and make an effort, because we as women sometimes we forget about taking care of ourselves. So I'm gonna leave you here all the info so you can make an appointment. Go to just make an appointment with the doctor and just go and see everything about your body. Is so important that you need to be able to share with somebody who has the knowledge. So don't go anywhere. Just that's why we are here. Doctor, it's so important for me to be able to interview you guys, because you guys are the best. Thank you so much. Any final remarks for our audience?
Well, yes. Again, thank you for having me. And yeah, let me take this opportunity to tell the patients that the most important thing is to listen to your doctors, come to your annual visit, the screening visit, and ask many questions. There is a lot of myth, as I said at the beginning. surgical technology, and we have all that, the latest technology, and the University of Miami has evolved over the last 5-10 years in an amazing way. And nowadays we have the treatment modalities that are really minimally invasive, and the recovery is going to be fast. And we treat not only hysterectomy, but many other gynecologic conditions with a state-of-the-art technology. So you're welcome to make an appointment to see us at the University of Miami.
Thank you, doctor.